Hello, I'm Dr. Farrow, and I'm here to talk to our senior citizens about staying safe on really hot days. Why am I talking to seniors? Because seniors are at greater risk for having heat stroke or heat exhaustion compared to their younger adult selves. Some of the reasons for this are that senior bodies tend to be less able or less efficient at regulating their temperature compared to their younger selves. This is especially important at the extremes of temperature, hot or cold, but we're talking about hot today. Another thing is that senior citizens, their bodies tend to be relatively dehydrated. So you're going into a situation where you can lose a lot of fluid from sweating, trying to regulate temperature or deal with the hot temperatures where you're already behind the eight ball. Another reason is that our senior bodies, compared to our younger bodies, tend to have a somewhat less efficient thirst mechanism. In other words, it takes the senior citizen, the senior body, longer to feel thirsty than he or she might feel thirsty at a younger age. Air conditioning units should be checked to make sure they're as sufficient as possible. If you don't have access to that, making sure you can go somewhere where you can stay cool when outside, being outside early morning or late afternoon when it tends to be cooler, actually even evening when it tends to be cooler, to do things like gardening and yard work. Drinking lots and lots of fluids. Water is the best. And doing this because you know you need to be hydrated and not waiting till you are thirsty, as I mentioned before. Limiting exposure to the sun and outdoor temperatures such that you time your gardening, your outside activities, playing, yard work, so that you're not out there for more than 20 to 30 minutes at a time, and then retreating to a cool space. Of course, covering yourself, wearing the big hats with big brims, making sure you use the sunscreen. That's a shout out to avoiding skin cancer, and otherwise planning ahead so that you can keep cool even though you may have to do things outside. If you can do these and if you can be aware of these things long before you are sweating a lot, getting fairly dry, and feeling the effects of the heat more than just, oh, it's hot today, you are more likely to avoid the development of heat exhaustion or heat stroke, and therefore avoid a medical emergency and medical trouble, and enjoy your warm days, your hot days much more, I hope.